In the United States, it's no secret that healthcare costs are skyrocketing. As recently as 2018, $3.8 trillion, that's trillion with a T, was spent on healthcare, with 75% of that spent on chronic diseases. And at an individual level, the United States spends, on average, about 2 times as much per person on healthcare costs than other wealthy countries. Since 2014, health expenditure per capita and as a percentage of the gross domestic product are gradually rising, while at the same time, average life expectancy is dropping. But what are we really getting for those increasing costs? Are we seeing better outcomes? And does everyone have the same access to quality, affordable healthcare? The answer, quite simply, is no. Along with the soaring cost of healthcare comes a growing health equity gap, meaning more and more people lack access to consistent quality of care, which results in avoidable, unfair, and unjust healthcare gaps. And why is that? Well, listen to this. In the United States, your zip code is a better predictor of health than your genetic code. Social determinants of health, which relate to the conditions under which people are born, grow, live, work, and age, have a massive impact on our community's overall health. How massive? Well, consider this. Out of 2.48 million deaths each year, around 900,000, or the equivalent of 8 plane crashes every day, are due to social determinants of health. Or that the average life expectancy for babies born in Kansas City can vary by as much as 14 years across neighborhoods just a few miles apart. For a more recent example, look at the COVID-19 impact on Iowa's Hispanic and African American communities, who saw a disproportionate share of COVID-related infections and deaths. The pandemic taught us that we need to provide health services where people are, focus on improving interracial communication, and strengthen the caregiving workforce for older adults. So, how do we properly address these problems? Ultimately, it comes down to upstream investment in social services. As a determinant of health, medical care alone is insufficient for better health outcomes. And in the United States, we are falling behind. In most industrialized countries, for every $1 spent on healthcare, $2 is spent on social services. And the United States? Well, for every $1 we spend on healthcare, only 55 to 90 cents is spent on social services. This causes health disparities that contribute about $93 billion in additive medical costs and $42 billion in overall lost productivity. If health equity were improved in the United States, we could save over $230 billion in healthcare costs alone. And what else would we get for that investment? Social determinants of health are influenced by policies and programs, and the ratio of social to health spending is significantly associated with better health outcomes. We'd see less infant mortality, improved birth weight, and lower premature death, along with longer life expectancy. And that's just the beginning. So, what can we do about it? It takes everyone, from medical providers to politicians to community and church leaders, to work together. Ask people about their social determinants of health. Identify resources in their communities that can help address them. And act to help connect people with the resources to help. Research shows that employed people are generally healthier and more productive. And without a high school diploma, people are 5 times more likely to have poor health. That's why Broadlawns Medical Center created the Teach and Tech programs to address social determinants of health by promoting careers in healthcare. With an overall graduation rate of 83% and the longest intern employed for 3+ years, the program has been an overwhelming success. With new payment models and frameworks emerging for integrating social determinants of health, now is the time to act. It takes all of us, but together, we can make our communities healthier.